Hi, welcome to HIMS TV. My name's Dylan Yogendra. I'm the managing editor at HIMS and Mia. I'm delighted to have with us Dr. Sam Shah. Sam, would you like to give yourself an intro, please?
Hello, Dylan. Great to join you. I'm Sam Shah. I'm the founder and director of the Faculty of Future Health, previously Director of Digital Development at NHSX, and currently Chief Medical Officer for Newman.
Fantastic. So Sam is someone that I've known for a while, very well known in the industry, a closing keynote at the HIMS and Health 2.0 European Digital event. And ahead of that, I just wanted to dive into some of the topics that Sam will be addressing during the event. So Sam, could you begin with giving us a quick overview of what the social determinants of health are?
So the social determinants of health, anyone that has been in this area, is really the causes of the causes. It's those things that cause healthcare to be poor, cause health outcomes to be poor. Let's give you an example. It's everything from the environment, education, travel, housing, all of those things are social determinants of health. But there's also a new one that I like to refer to, and that's the digital component, because today, technology and the internet is just as important as those other things. So for me, all of those are social determinants.
At HIMS, we've launched a global health equity network to advance the cause of health and wellness for everyone, everywhere. Do you think healthcare systems truly understand the importance of social determinants in your experience?
I think people in systems generally do. And there are lots of people that do understand that issue of inequity in access, that it's about fairness. But the problem, of course, is systems are made up of so many components. They're reliant on legislation, policy, and other parts of society. So whilst a system itself may have the right components, we do need to raise awareness. And that's raising awareness at every level. And that's also helping people understand that inequity in access to healthcare and inequalities are far wider than any health system. In fact, most of it happens outside a healthcare system. So whilst we do have lots of people that take it seriously, especially in the public health community, there's always much more we can do, and much more we can do to help prevent people from becoming ill in the first place, but also helping them with other ways of accessing services.
And so do you think much progress has been made over the last few years in your experience?
I would say the progress has definitely not been as far as I'd want it to go. And if I look back at what happened 10 years ago when Sir Michael Marmot wrote the Marmot Review that focused on inequalities and inequity in healthcare, at that time, we were focusing on lots of things like domestic violence, teenage pregnancy, obesity, education. Now, while some gains have been made, certainly not enough. Now, you might say, well, we've got still better outcomes than other parts of the world in the Western world, but that's still not good enough. We need to do much more to reduce that inequity. So whilst there have been some early gains, certainly not enough across the system. And inequity exists at every level, exists in every community. There will always be pockets. And so we need to do much better at highlighting those and coming up with solutions that meet the requirements of those individuals. And so I would say, while some gains have been made, there are always new problems that are emerging. And with every development and advancement in technology, there will always be further inequities that come about.
So Sam, could you just tell us a little bit about some of the countries or health systems that are addressing the social determinants of health well? Are there any learnings that can be taken from them?
I think there are lots of places in the world that are trying to address the social determinants of health. Take, for example, the preventative agenda that's being progressed in the UAE. They've really combined together data sets in places like Abu Dhabi, looking across the whole of their population to really target those people in the population who really benefit from some intervention. They're doing the same in other places. So, for example, if we take Royal Adelaide Hospital and that health system, they've again combined together the healthcare data across that entire environment. And something similar has happened in Canada at the Humber River Side Hospital. That's also doing something very similar. So there are good examples around the world where that approach is being taken. I would say nobody in the world has completely cracked it. And there are good insights around why accountable care organization types of model could certainly work. But again, like everything, we need to do more to bring together different data sets. And in an ideal world, we'll be bringing data together from people's wearable devices, from their smart devices, the environment around them, combine them with data from their health record, as well as their utilization of healthcare, the combination of those things would give us a far better approach to public health, whether that's targeting smoking cessation, whether that's dealing with the consumption of alcohol, or whether that's even helping people with nudge around physical exercise and activity. We could do a lot more. So there are lots of health systems around the world that are trying, and there are good examples of ways that individuals and organizations have started to do this. But there isn't any one health system in the world that's got every component.
I think moving on from that aspect, Sam, can you tell us a little bit about the impact of COVID-19 on social determinants and the kind of exponential increase of telehealth in particular? Has that had an impact on this particular area?
COVID-19 has been so interesting to follow, not just because of the fact it's an infectious disease, but also because the way in which the behaviors of the population have changed, and also the wider impact around inequalities in society. And if we take COVID-19 and what happened over the last few months, we've really exposed some of the inequalities in society and some of those risks. So if we start off, well, we can see already that from the death rate in the population and those people who have experienced COVID, especially if we take Western communities, we can see that there have been a series of individuals, particularly those from Black and Asian ethnic minority communities and the Jewish communities, that have really suffered a lot. And now you might wonder, what are some of the reasons behind this? And if I look at the reasons, we don't completely know why. And the data from annual reports and reviews that have been undertaken don't really give us that depth. But we do know there are probably factors around housing, deprivation, education, transport, jobs, that are all factors in this. So particularly, ethnic minority communities in deprived areas seem to have been affected far more than others. And you see that in places like Newham in England as an area, for example. But Newham's not unique. There are other parts of the world too. And some of that can be cultural, but a lot of that is going to be around deprivation and inequalities that have driven and exacerbated the downside, the very downside of COVID-19. So we can certainly see that COVID-19 has really exposed the worst inequalities in society and the negative impacts. But alongside that, during COVID-19, we're also probably all familiar with the way in which telehealth has had a massive part to play in the way in which people have accessed services. Now, I think it's a good thing that we've seen some of that acceleration and that adoption of telehealth in society, especially the use of online consultations. The only downside of it, of course, is that it does mean that those people that don't have access to the internet, that can't afford access to the internet, clinicians that might have poor access to the internet, their patients or those communities themselves may not yet have accessed those health services, not because they don't want to, because they can't. They may not have the skills or they may not have access. So it's been great to see the use of telehealth as a way, as a channel. But at the same time, we've got to recognize there's a whole group of people out there that don't necessarily have access and may have the greatest need. That digital divide, and it still exists. So COVID-19 has shown us both the worst in inequalities, but also in some cases where we can address those things. Going forwards, I think telehealth has to stay as a mode of access, because for many people, it might actually provide them with more convenient access, but also more efficient access. And that's a good thing. If we can keep people economically productive, active in the workplace, not having to take time off, those are all really good things. But whilst doing that, we also need to level up. We need to make sure that somehow governments around the world, societies where people do suffer deprivation, are given better access to technology so that they can consult in the same way. Now, some of the new things might be, how do we use digital diagnostics? How do we give people access to, for example, blood tests, which are more convenient to them, avoiding the need to take time off work? All of these things are possible and within our gift. But at the moment, we haven't seen that level of investment go into those areas. So it's great to see online consultations used far more and more by different societies. But alongside that, we have to think about what are some of the barriers. And those barriers could be language, they could be deprivation, they could be access to the internet itself.
Fantastic. And I think that chimes with a lot of what will be actually discussed in more detail at the HIMSS and Health 2.0 European Digital event. Can you tell us a little bit more about what the audience can look forward to during your closing keynote session?
Well, I'm really looking forward to HIMSS 2.0, and this year is going to be one of those years where public health really comes into its own, and digital is going to be explained and described in a way probably never heard of before, or at least maybe not the same emphasis we've ever had before. And so for me, I'm going to be focusing on those things that have been done in different parts of the world, particularly to address health inequalities, deal with the social determinants, but also dealing with some of the digital divide. But I'm really looking forward to some of the keynotes. And one in particular is the one about data saves lives. That's one that I'm really looking forward to because I think the speaker's clearly got a lot of experience, having been a former minister, but also the topic area is one that is so important to us. And there's quite a few sessions there around critical care and COVID, another area that we can learn so much from, because it's an opportunity for us to reimagine the way we deliver future healthcare. So I'm really looking forward to this year's HIMSS, and especially being able to discuss both public health and digital, things that are both important to me.